As oncologists, is we've done the hard part with kind of removing it with surgery, but then we look at how we can prevent it from coming back, because it was a little bit of a bigger tumor than we sometimes see, and it looked like under the microscope that it could grow a little bit fast. Because it was a higher grade. Grade means that the cells are turning over kind of quickly. So when it moves to the lymph node, in general we recommend chemotherapy to prevent it from coming back. And all this it's aggressive, but it's preventative medicine, because if it goes to the lymph nodes, we know that there's a higher chance that it could come back later, and it's easier to treat it and prevent it from coming back than to allow it to come back later and it come back somewhere else outside of the breast.
So with it traveling to even the one lymph node, that definitely is an indication that it could have come back or it could have progressively gotten worse.
It's an indication that we're at risk that it could come back in the future. Not necessarily that it's going to come back right now, but that if we don't manage it
or take precautions
with chemo, that it may come back in the future. So right now, looking at everything, I think we have removed what's there, but I think if we want to be absolutely, we can't ever say 100% sure, because we could do all the chemo and it may, it can still come back sometimes, but we like to make sure we take every chance to increase the odds that it won't come back.
Okay.
And because you're not hormonally positive, we don't have the hormone blocking pills as an option. So our main other option is chemotherapy. And because you have a higher grade tumor, those actually respond very well to chemotherapy.
So how strong and how long does she have to?
So typically we do 8 treatments. They're 1 day every 2 weeks.
Okay.
And so it's a total of 16 weeks. So it's over about 4 months.
Okay.
And it has some side effects, but especially if you're young and healthy, it's manageable. So we do see some hair loss. We see some fatigue, some mild nausea, but the nausea is very controllable. It can lower your immune system a little bit, but it's typically not anything where we see a lot of infections. We usually just see, some mild fatigue, mild nausea, and that's really
No mood changes.
Uh,
'Cause I don't want to get beat.
most of the time, with anything like this,
Right, no.
there's a lot of anxiety.
Okay.
That's what I was telling her. That I think that's been the other thing. I haven't had to deal with any anxiety in a long time.
Yeah.
And I told her it has had my anxiety through the roof.
Sure.
Even sitting here waiting, it was just like.
Right.
And I'm really not that kind of person. I'm usually okay, just chill out. But this whole.
Got you anxious.
This whole ordeal. Especially when I found out no one in my family, I had it, and it's been more extended family. And when I say extended, it's more like the in-laws of the in-laws. So these people are not directly related to me.
Sure.
So there was nowhere could I trace of anyone in my family that had ovarian, that had breast cancer, that had cervical cancer. Even the men, the men, even on, the father's side of the family was just more over old age or, something like that. So the whole ordeal has just been really stressful.
Yeah, I've watched her become the person that usually give advice and the consoler to complete opposite. So that's why.
Well, and it's hard because it's a very emotional thing. You
Yeah.
know, it's you go from being used to being very healthy to feeling like you're sick, even though you know. And it is something to process. One thing I'll encourage you by saying is that, you know, the one thing I want you to remember through this whole thing is that, you know, when you did the surgery, you removed the cancer, and what we're doing now is more of as a preventative thing.
Okay.
And everything with chemo, like all the side effects that may come, are temporary.
Okay.
And so you're gonna feel better again. And even though you don't feel better right now, we're gonna make some changes in the medicine to help you feel better quicker and help you feel as good as you can feel. Some of the numbness is gonna be there, but the pain can be better managed. The arm swelling can be better managed. You know, there's things that we can do. So pretty much with all the side effects with chemo, there are things that we can do to make it manageable.